This is the reset strategy for Intracoxa, or internal rotation of the hip. You're going to stand sideways against the wall and lean the elbow into the wall and walk the feet out until there's a nice angle between you and the wall. The hip that you're working on is the hip closest to the wall. You're going to bring the opposite leg up to about 90 degrees. You're going to lean towards the wall and you're going to rotate your pelvis so the knee points towards the wall. From here, you're going to shift that knee forward towards the wall, pressing into the back heel of the opposite leg. You can also put your foot onto a ball as you do this to make it a little bit easier. That's for internal rotation of the hip.